the study methods were unique in healthcare, but very common in industrial engineering and error reduction. So the use of distance matrices is starting to be realized because we have more powerful computer hardware and also software. Our strengths of the study because of these methods were lower susceptibility to point in time bias. So that's measuring patients at different points in calendar time. We actually controlled for those differences. We also achieved a stronger predictive probability for patients. So we match patients with similar disease histories more closely than prior studies. And the result of these methods improvements overall means that we could be more sure in our study that our comorbidities were attributable to RA. So we were more sure of our causal attribution mechanism because we had an increase in predictive performance of the methods. So the methodology used is very versatile and has a diverse set of applications. We actually applied the exact same design methods for another study looking at RA attributable healthcare costs. And I will say that the methodology is limited only by the person's data and imagination. Any disease or application with a set of prior data, a definable high quality exposure definition, and measurable follow-up data could be used or is a candidate to use distance matrices, which is the method that we used in our paper. Our team is looking at other applications like focusing on individual level comorbidities and also increasingly focusing on the pre-disease histories of the patients. This is a really difficult question to answer because our healthcare services databases in the entire world, not just Canada, they're always 2 to 3 years behind today's date, and 2020 is not over yet. So we won't know the full impact of COVID-19 on RA care until 2022 or 2023, once all our data is actually in from these databases. However, we can see huge impacts, both negative and some positive, from the COVID-19 pandemic. Anecdotally, across the world, clinic hours have been reduced, but this has led to a rapid uptake of telemedicine. So there's certainly a double-edged sword there. I would say that patients with rheumatoid arthritis and all patients with any chronic disease, they have been overall, I would say, negatively impacted by the COVID-19 pandemic because of understandable human and material resource limitations that no one wants, but that are the realities of a global crisis. I do hope that all patients with RA are able to access their medications, general and specialist care, and that they remain healthy during this time.